So, I want to take you to a very specific place today.
Okay, where are you going?
Picture this. A small island in the English Channel. It's windswept, super rocky, and only about 8 miles by 5.
Sounds cozy.
Yeah, right. It's not exactly a global hub, and it is certainly not the easiest place to get to. We're talking about Guernsey.
Guernsey. Okay, that definitely sets a moody scene. It kind of sounds like the beginning of a classic mystery novel or something.
It really does. But the thing is, recently this little island hosted a gathering that honestly feels like it should have been on the front page of every major newspaper in the world.
Oh, for sure.
You had about 300 people packed into a room, and we're talking about some of the most credentialed, world-renowned doctors and researchers on the planet.
And yet, if you were, just watching the evening news or scrolling your feed, you wouldn't have heard a whisper about it.
Exactly. Total ghost count in terms of media coverage. And that silence is what we're digging into today for this deep dive. We're basing this on a really fascinating report by Neil Oliver regarding this event, which was an international health conference. But more importantly, we are going to crack open the source material that was the absolute centerpiece of that gathering.
The Pfizer papers.
The Pfizer papers.
And just to be super clear for everyone listening, right out of the gate, when we say the Pfizer papers, we are talking about internet speculation or, fringe theories.
Definitely not.
We're talking about Pfizer's own internal documents. These are the millions of pages of safety data that they actually attempted to keep sealed from the public for 75 years.
75 years. Just let that sink in.
Yeah. And they were only released because a court order literally forced them to do it.
That context is everything here. We are sitting here analyzing what critics think happened. We are impartially looking at what the company's own data says happened.
Right, we're just following the paper trail.
And the findings presented by these researchers on that island, well, pretty explosive. They paint a reality that is diametrically opposed to the official story we've been told for the last few years.
It is a dense, heavy topic, no doubt. But our mission today is to make it accessible. We need to understand why these top-tier experts traveled all the way to a tiny remote island to share this info.
And why the mainstream press just decided to look the other way.
Exactly.
So let's start with the setting itself. Neil Oliver was there, and he describes the atmosphere so vividly. He notes the conference was titled Life and Health Beyond COVID. But he points out this massive, glaring irony regarding the location. Guernsey isn't just remote. Statistically, it is one of the most vaccinated populations on Earth.
That is such a crucial detail. Oliver points out that about 93% of the people on Guernsey are vaccinated.
93%.
Yeah, they followed the guidelines to the letter, rolled up their sleeves, took the shots, took the boosters. So you have this population that is arguably the ideal model of compliance, hosting a conference that is methodically dismantling the safety narrative of that very product.
Talk about being in the belly of the beast.
Truly.
And the speakers on stage, they weren't there to scold anyone. They were just there to share the data. And looking at the roster, I mean, these weren't amateurs. Oliver lists them off. You've got Peter McCulley.
Right, a highly credentialed cardiologist from Texas. I mean, before the pandemic, he was one of the most published and respected figures in his entire field.
You have Angus Dalglish.
A preeminent oncologist, a leading cancer specialist.
And Del Bigtree, the journalist and filmmaker.
These are people who have dedicated their entire lives to medical science and investigative work.
And Oliver makes this really poignant point. He says these experts have been, in his words, howling into the wind for 6 years.
Howling into the wind. That metaphor is perfect for that windswept island setting.
It really is. They've been diligently, forensically analyzing this data, trying to warn the public, but they've been met with what he calls the blindest of blind eyes.
It captures the frustration perfectly. You have the hard data, you have the world-class expertise, but the microphone has just been cut.
Yeah.
Oliver actually notes that the media was fully informed about this gathering. They knew these 300 people were meeting. They knew the caliber of the speakers.
And yet,
not a single representative from the world's mainstream media bothered to show up.
It really makes you wonder, if you have a gathering of top-tier scientists discussing global health safety data, usually that's headline news everywhere.
Oh, absolutely.
The fact that it was totally ignored suggests that the information they were presenting was, well, inconvenient.
Inconvenient is putting it mildly. The signal coming out of the Pfizer papers contradicts the established narrative so thoroughly that it seems easier for the establishment to just pretend it doesn't exist.
Rather than actually try to debate it on the merits.
Exactly.
So let's do what media wouldn't. Let's look at the actual documents.
Yeah.
This is the core of our deep dive today.
Let's get into it.
We are talking about the book, The Pfizer Papers. This is the result of Dr. Chris Flowers and literally thousands of volunteers combing through those court-released documents.
A massive undertaking.
Huge. And one of the absolute biggest revelations they found concerns what they call the mechanics of dispersion.
Okay, this gets a little technical, but we really need to break it down because it changes everything about the safety profile.
Go for it.
Do you remember the slogan when the rollout first began? We were told repeatedly and explicitly that the vaccine materials stay in the deltoid muscle.
Right, it stays in the arm.
It stays in the arm.
That was the promise. It's supposed to hang out there in your shoulder, teach the immune system a quick lesson, and then just disappear.
Well, the internal documents show that Pfizer knew that was false. They tracked the materials, specifically the lipid nanoparticles.
Let's unpack that term for a second. Lipid nanoparticles. What exactly are we looking at there?
Think of the lipid nanoparticle, or LNP, as a microscopic delivery vehicle. It's a tiny fat bubble. Its job is to protect the mRNA payload so it doesn't get destroyed by your body before it actually enters your cells.
That makes sense.
And these LNPs are coated in something called polyethylene glycol, or PEG. This coating is essentially a stealth mechanism. It helps the particles slip through biological barriers undetected.
Got it. So it's like a stealth delivery truck. And the public claim was that the truck parks in the arm muscle.
Correct. But the internal data shows the truck absolutely did not park. The source material uses a very aggressive analogy here to describe what actually happened.
What's the analogy?
Like a shotgun blast.
A shotgun blast. Wow. That implies it goes everywhere, instantly.
Exactly. Within 48 hours of injection, the documents show that these materials disperse throughout the entire body. It wasn't localized at all. It was systemic.
So it's circulating in the bloodstream. Where did it actually end up?
This is where Dr. Robert Chandler's work comes in. He's a specialist in pathology and one of the key analysts of these papers. He found that these materials cross every membrane in the human body.
Every membrane.
Including the blood-brain barrier.
I want to pause on that because the blood-brain barrier is a huge deal. That is our biological fortress.
Yeah.
It evolved specifically to keep toxins and foreign substances out of our central processing unit.
And yet the LNPs crossed it, and they didn't just pass through, they accumulated. The documents list specific organs where high concentrations were found.
Which ones?
The liver, the adrenals, the spleen, and the brain.
The spleen and the liver, I mean, those are our vital filtration organs. But there was another finding, specifically regarding women, that feels particularly heavy.
Yes. The accumulation in the ovaries.
In the ovaries.
That's what the internal data showed. And you really have to consider the implications of that. We aren't talking about a sore arm anymore. We are talking about the reproductive system.
Right.
And Dr. Chandler noted something else. This is perhaps the most disturbing part of the mechanics here.
What was that?
He saw no mechanism whereby these materials actually leave the body.
Wait, explain that. What do you mean, no mechanism?
Usually when you introduce a drug or a compound, you study the pharmacokinetics. You track how the body breaks it down and gets rid of it.
Right, the exit route.
Exactly. Chandler's analysis of the Pfizer documents suggests there is no clear off-ramp.
Wow.
The implication is that with every booster, every additional shot, you are potentially packing more of these materials, these industrial fats, mRNA sequences, and spike proteins directly into those vital organs.
So it's a cumulative effect. Instead of a temporary instruction, it's a buildup.
That appears to be exactly what the internal data indicates. And if you have an accumulation of foreign material in the liver, the brain, and the ovaries, you have to ask yourself, what does that do to the human body?
Which leads us directly to the side effects.
Right.
The public narrative was always safe and effective. You know, maybe you get chills, a fever, maybe you feel a bit tired for a day. That was the official script.
That's correct.
But the internal reality at Pfizer seems to have been vastly different. The source mentions a staffing decision that just completely blows my mind.
Oh, the hiring surge. Yes. This is one of those administrative details that reveals the truth so much better than a PR statement ever could. Pfizer had to hire 2,400 full-time staffers.
2,400 people. That is a small army.
And their sole job, their only purpose was to process the massive increase in adverse event reports that were just flooding into the company's safety database.
You don't hire 2,400 people to handle mild headaches and chills.
No, you don't. You hire them when you are completely overwhelmed by the volume of serious, complex complaints.
And the timeline is the most damning part here. The source states that Pfizer knew by February 28th, 2021.
Yeah.
That is just 90 days after the public rollout began. 90 days, and they knew there were serious problems linked to a myriad of adverse events.
Think about that context. By February 2021, the global marketing machine was in full gear telling everyone on Earth it was perfectly safe. But internally, their own database was logging what the source calls catastrophically serious events.
I'm looking at the list of conditions recorded in the documents right now, and it's a lot. We are not talking about minor inconveniences here.
Not at all.
The documents listed severe COVID-19, which is pretty ironic in itself, and respiratory failure.
And it goes on. Liver injury, kidney injury, neurological adverse events, facial paralysis.
Autoimmune diseases, multiple organ dysfunction syndrome.
Yeah.
And then there are these specific, almost obscure conditions listed, like chilblains.
Chilblains is fascinating in a really dark way. It's a form of vasculitis, which is an inflammation of the small blood vessels, usually affecting the fingers and toes.
So it's vascular.
Right. It suggests that something was happening to the vascular system at a very micro level.
And they also saw the activation of dormant herpes zoster infections. It sounds like the immune system was being so distracted or dysregulated that it allowed other underlying things to just flare up.
That perfectly fits the pattern of multiple organ dysfunction. But the category that has likely caused the most public concern and was a massive focus at the Guernsey conference is the cardiovascular data.
The heart issues. We've obviously seen the headlines slowly trickle out over the years about myocarditis, but what did Pfizer actually know internally, and when did they know it?
According to their own documents, they knew about the damage to the hearts of young people by April 2021.
April 2021.
The list of known issues includes myocarditis, pericarditis, tachycardia, arrhythmia, and various lung clots, leg clots.
I really want to emphasize that date, April 2021. Think about how many mandates for colleges, for sports teams, for the military, for keeping your job were enforced long after April 2021.
Exactly. Millions of young, healthy people were compelled to take this product months, even years, after the company had internal data showing a clear risk to their hearts.
That is wild.
That is the massive disconnect that Neil Oliver and these researchers are screaming about. It's not just that the product had risks. All medical products have risks. It's that the risks were known internally, yet the public policy didn't change at all.
It's a complete betrayal of informed consent. I mean, if you tell me safe and effective, I'll probably say yes. If you tell me, hey, we're seeing heart damage and organ accumulation, I might say no.
Right, you get to weigh the risk.
But we weren't given that choice because the data was literally locked away.
And that deliberate suppression of data brings us to the next major revelation from the conference. It wasn't just the Pfizer papers being discussed on that island. The night before, Del Bigtree actually premiered a film called An Inconvenient Study.
And that title is just perfect. This film focuses on a study coming out of Henry Ford Health. Now, for those who don't know, Henry Ford Health isn't some fringe blog. It's a prestigious, massive healthcare and research system.
It is absolute top tier. And the study, which was conducted by Dr. Marcus Zervos, was investigating basically the holy grail of vaccine safety questions.
Which is
a direct, data-driven comparison of chronic illnesses in vaccinated children versus unvaccinated children.
I feel like parents have been begging for this exact study for decades. And the standard answer from the medical establishment is always, oh, it's unethical to do that study or it's statistically impossible.
Well, Dr. Zervos actually did it. He had the data. And according to the source detailing the film, the findings were incredibly stark.
What did they find?
The study found that children receiving the full suite of childhood jabs were, quote, demonstrably less healthy than the unvaccinated group.
Demonstrably less healthy. That is a total bombshell. That challenges the absolute foundational assumption of modern pediatric care.
It really does. It implies that the cumulative effect of the schedule might be causing a net harm in terms of chronic long-term illness. But here is the inconvenient part of the whole thing.
Let me guess. You can't just go online and read this study in a major medical journal.
Nope, you can't.
Why not? If the science was done by a top researcher at a top institution using their own data, where is it?
Henry Ford Health refused to publish it.
They just outright refused.
The source quotes their official statement directly. They claim the report, quote, did not meet the rigorous scientific standards we demand as a premier medical research institution.
Wow.
And then they immediately followed that rejection with the standard prepackaged dogma. They reasserted that, quote, data has consistently shown vaccinations are a safe and effective way to protect children.
That feels incredibly circular to me. It sounds a lot like they're saying the study results contradict our established policy, therefore the study itself must be scientifically flawed.
That is exactly the allegation presented in the film.
Okay.
It highlights the mechanism of institutional gatekeeping. I mean, science is supposed to be about following the data wherever it leads, even if it leads somewhere deeply uncomfortable.
Right.
But this situation suggests that when the data leads away from the established vaccination schedule, the door is just slammed shut.
It's censorship by bureaucracy. It's not that the conflicting data doesn't exist. It's that it's just not allowed to enter the public record. And this brings us back perfectly to the broader philosophy that Neil Oliver discussed at the end of his report on the conference. He talks about something he calls the Great Noticing.
This is a really important concept to wrap our heads around. Oliver argues that we are living in a very unique historical moment right now.
The Great Noticing.
Yeah. People are starting to see these massive disconnects everywhere. They are noticing that the safe and effective slogan on the TV doesn't match the myocarditis headlines they see in real life. They are noticing the complete silence of the media on an event like Guernsey.
It's like the spell is finally breaking, people are waking up. But he warns that just noticing isn't actually enough, right? He uses this great metaphor about a lion.
Yes, the old proverb. The truth is like a lion. You don't have to defend it, let it loose, and it will defend itself.
That's a nice thought.
It is a comforting idea, right? That the truth always wins eventually by its own merit. But Oliver argues that in this specific case, it ain't necessarily so.
Because the truth is already out there. I mean, the Pfizer papers are public now. The findings on organ accumulation, the shotgun blast dispersion, the early heart damage data, it is all right there in black and white in their own documents.
But the lion isn't eating anyone.
Right. The machinery is still running exactly as it was. The people who authorize these policies are still comfortably in power. The medical protocols haven't fundamentally changed.
So what's his point?
Oliver's point is that the truth is actually powerless if it is met with a giant wall of indifference or active suppression by the people in authority.
He says we might notice ourselves to death.
Yeah.
That is such a chilling line. We might notice ourselves to death. It implies this terrifying state of paralysis. We see the crime, we literally see the weapon, but there's no police to call because the police are the ones holding the weapon. It creates a massive crisis of citizenship. Think about it. If 93% of the people in Guernsey followed the rules because they fundamentally trusted the system, and then they find out the system was actively hiding critical, life-altering safety data from them, what does that do to the social contract?
It breaks it. It completely shatters it.
And Oliver's challenge to the audience was that noticing the discrepancy is just the first step. Noticing the crime is not enough. It requires actual action. It requires a willingness to stand up and say, no, I see this data and I will not pretend it isn't happening just to be polite.
It really circles back to why all those brilliant minds were gathered on that island in the first place. They were there to build a permanent record of the truth, even if the mainstream cameras flat out refused to roll.
And that's exactly the value of looking at these sources. We've gone from the microscopic level today, the lipid nanoparticles crossing the blood-brain barrier, to the massive systemic institutional level of hiding 75 years worth of documents. But the thread connecting all of it is the desperate need for transparency.
Because we rely on these institutions to filter reality for us. We just assume that if something was truly horribly dangerous, the FDA or the CDC or the major papers would be screaming about it from the rooftops.
Right.
But this deep dive suggests that the filter we've been trusting has actually become a blindfold.
And a blindfold is a very dangerous thing to wear when you're dealing with your own health. The big takeaway for you, the listener, is about understanding the sheer depth of the data that exists beneath the surface headlines.
Yeah.
It is difficult to read court-ordered medical documents. It's boring, it's dense, it's full of jargon, but that is exactly where the actual reality lives.
You cannot rely on the people who sold you the product to be the ones to tell you if it's defective. That's the core lesson here.
Precisely.
So as we wrap up this deep dive into the Guernsey revelations and the Pfizer papers, I want to leave you with a final thought to mull over, something to explore on your own.
We've established that the data is finally out there. It is printed in the company's own internal reports. It is technically public knowledge now.
But if the official top-down narrative remains completely unchanged, if the systems of authority flatly refuse to acknowledge what is written in their own documents, does simply knowing the truth actually give you any power?
Or are we all just destined to be like those researchers, endlessly howling into the wind on a small island?
What happens when the truth becomes just another piece of trivia that the system ignores? That is the question we all need to figure out how to answer. Thanks for joining us on the deep dive today. Keep noticing, keep reading the primary sources, and don't be afraid to ask the loud, inconvenient questions. We'll catch you next time.